on Monday night we run a clinic at the men's shelter, okay? So then whoever is wanting to see a doctor can just come into our room. We do the same thing on Tuesday morning. On Wednesday we take our truck out and we look around for people, right? So we know that there's people on the square, but there also might be people in the forest or in the parking lot or even in a storage unit.
Welcome to the Home Comfort Zone podcast. I'm Theresa. I'm the marketing manager at All Comfort Services. Today I have Donna Maysak, and she is the community engagement coordinator at Madison Street Medicine. Welcome, Donna.
Thank you.
So I'm really interested to learn more about Madison Street Medicine. I recently, you sent an email to us, and I was curious about what it was all about, and so I invited you to come here and talk about it. I never knew it existed.
Yeah, that's so we've been around for 10 years, going on 11 years actually, and a lot of people haven't heard of us. So we are the only street medicine in Dane County. We bring free health care to people who are living outside. And we've been doing it for 10 years. We run several brick and mortar clinics and shelters, but we also have a van that we take out to where people are, wherever that is.
How did that get started in 2011?
It started with our foot care clinic. So that's our first clinic where, there were some doctors who realized, how much people who are living outside that they need care for their feet. So the foot care clinic started, and it grew from there.
And so how are you able to keep it running? What are the things that you need?
Well, we have over 100 volunteers. Most of them are doctors, nurses. We have some CNAs and EMTs. And then we also partner with the medic program from UW with the medical students. We also have outreach. So we also do, we have case managers who do housing programs or enroll people in housing programs.
And how do you keep how about the funding piece of it to keep the lights on and to make phone calls, for you to be there to make the phone calls and send people out to do the work?
We get a few grants, and then and that's what mostly that's where the money comes from. We hopefully we get donors, but financial is a difficult thing right now. So
right. So anyone who's listening and wants to donate, they would just contact your organization. They could donate.
Yeah, they could contact me. That'd be great.
What are some of the things that you need right now in addition to funds?
So we always need supplies, and we have an Amazon wish list. But we can take even used items as well, right? Blankets and coats and gloves and clothing. Some clothing. I mean, right now we're filled with some clothing because I have a great collab with a used clothing store in town, but we always need like sweatpants. We always need usually sleeping bags and tents and all camping supplies, water bottles. We have a whole list. I have a whole list on the website.
How does this happen? For example, what's the process? So how do you find out that someone needs help, and then how does it get from the people that are volunteering to the people that need help?
Well, on Monday night we run a clinic at the men's shelter, okay? So then whoever is wanting to see a doctor can just come into our room. We do the same thing on Tuesday morning. On Wednesday we take our truck out and we look around for people, right? So we know that there's people on the square, but there also might be people in the forest or in the parking lot or even in a storage unit, or we keep our eyes out. We look around, see people who are maybe outside asking for help, and then we have our office is located in the Social Justice Center, so we have space for people to come in during the day and get out of this weather or the hot weather or whatever, get some food, use the phone, computers, get supplies. We have outreach workers who are keeping vigil, trying to find, where people are. If we see an encampment, we get information from everywhere, right? Even sometimes from the law enforcement, social workers.
So anyone, if someone was concerned, they could contact you?
Absolutely. Yes, please do.
And so at any given time you might have, you have 100 volunteers, but what is the crew, do you have like a scheduled crew that works week to week, or is it more weather-based, where you staff it or is it just need-based?
So we do outreach for like 8 times a week, okay, not including our clinics, where our outreach members go out, but then a couple times a week they also go out with doctors, and they sign up for that. So they sign up for when they're available, and then the same for our clinics. We coordinate our volunteers. They sign up for when they're available, and it works out pretty well. We have the best volunteers, like you wouldn't believe. The most humble, kind, giving doctors that you've ever met, and nurses, and all this medical team is amazing.
So if anyone is a medical professional who happens to see this, could they volunteer? Someone from Madison Area Technical College, a student from there, other technical colleges?
Our needs are always changing, so you can always visit our website, but we are always looking for prescribers. So any doctors, any nurse practitioners, or physician's assistants, we are onboarding. And then, so when students leave or whatever, then we have to start looking again. And so I just would invite you to check the website. If you're a CNA or an EMT or an MA or an RN, we would, have openings for you.
Right, and even some retirees that...
oh, absolutely. Yeah. We have a lot of our doctors are retirees, which is great because then they have more time.
Right. And the medical facility that you have is located on Mifflin Street?
So our office is on Williamson Street. We do have a full-time nurse that people can come in and see her when she's there, but we only have one nurse because we have funding issues, right?
Okay.
So our nurse goes out all over, all the time, is taking care of people. And then people can come to our clinic on Monday nights. So that works like this. So there's intake workers who are CNAs and nurses, and they take vitals and find out why a person is wanting to see the doctor. And then after that, that client would meet with a medic student who would find more in depth about what's going on, and then go out and confer with the prescriber, who then they will come up with a plan and go back in and talk to the patient. So that that might include medication, which we get donated to us from this wonderful pharmacy in town, or just managing whatever's going on. And we also can help people get connected with their primary care providers and that type of thing. One of our goals is to keep people out of the emergency room, right? So we have these clinics so that hopefully it's saving money, right? But also a big goal is to build relationships and connections between the healthcare system and unhoused people. People who are poor a lot of times don't get treated very well at the doctor's office. They are stigmatized, and so they don't seek care until, honestly, they need to go to the hospital. So we're trying to be that bridge, okay? Because when you bring healthcare to where people are, you can help build community, you can help build relationships and trust between those, the unhoused people and the healthcare system, and it works.
It's filling a really nice gap in the community.
Yeah.
And what would you say the Madison area, as far as said, could be other smaller towns? Are we seeing an influx of care needed, or is it?
Oh, sure.
What is the demand?
Well, I mean, just on this, I think just last night there were 390 people staying at just the men's shelter alone. It's breaking records. So the homeless or the unhoused population is not diminishing.
So this is a really good story to share and would help a lot of people who may be able to provide help to hear the story.
Yeah, thank you for the opportunity.
Yeah. Is there anything you'd like to share that I haven't asked you that might be of interest?
So our foot care clinic, so that's run once a month, okay, and it's done in a shelter, and it's hugely popular. So last month I think we did 46 people in 2 hours. Where people can come in and they can get like a spa treatment, like a nice soak and a wash and nail trim, and if they have some wounds or they have some other needs, there's physicians there who can attend to that. And then afterwards we can give out shoes and socks to people, or actually 2 months ago I gave out boots. But that's a an uplifting clinic because you can really see, honestly see that you're making a difference. You know, people are smiling, most of them, and happy that we're there and very thankful. So we know we're making a difference. And you know, we are. We just always want to do more.
Right.
So I have, you know, 5 foot washing stations where there's literally doctors on their knees washing the feet of people who live outside. It's a pretty profound, honestly, and pretty powerful scene. And it's a great thing to be a part of.
So, Donna, tell me about some of the successes that the organization has had.
Well, we do a lot. We have a lot of successes with our healthcare, right? So we're keeping people out of the emergency rooms. We're bringing healthcare to where people need it, and we are getting people housed. So we had 2 actually clients in the past couple of weeks, long-time clients who finally got apartments, and that is a celebration.
What are some of the organizations you work with within the Madison community?
So you mean other nonprofits? Well, I mean, Porch Light runs the men's shelter.
Okay.
Catholic Charities runs the Beacon. So there's 2.
Okay.
Yeah. But I partnered with the Madison Marathon in the fall when they were doing the run to get, and the runners brought in their shoes.
Oh.
So they're used shoes and so for our clinic. So now we have like a mountain, a literal mountain of shoes.
That's a great way to get shoes. That's fantastic. I really appreciate you coming down here to tell the story. And hopefully people listening will be able to, maybe they'll look up your website and maybe they can help you out in some way.
Thank you. Thank you so much. It was great to come.